it's so easy for people to take the position, well, what can I do? I'm just one person. How can I, help end racism? What is my role? And so we've been talking a lot at Rush about the idea of individuals being the change, to take up the mantle as an individual and do what you can do. And so I'll start with you, Marshall, to just talk a little bit about how you are being the change, and then I'll move to Hatch Senior, and then I'll come to you, David, to talk a little bit about some of the West Side United work. But let's start off with you, Marshall.
It's no secret that West Garfield Park has been one of the forgotten neighborhoods of Chicago. And so when I graduated from graduate school, I didn't really have a choice but to come back to the church that had nurtured and produced me and commit my life to the same mission, the same vision that so many others before me did. That same vision of lifting up those who have been cast down, the downtrodden, the disinherited. And so that's essentially what MAAFA is. It's an extension of the church, but it's also an extension of that rich legacy of the Black church at its best, which is not only the center of African-American life, but the moral conscience of the country. And so that's what I'm committed to doing. And I believe that we are inspiring young men every day to see themselves anew, to see themselves as leaders, as change makers. And so that's how we are inspiring change from the ground up.
I certainly appreciate Marshall's, the breadth of his insight in the moment that we're in. And for me, I've tried to, as we built the institution and built upon what we received from the previous generation at New Mount Pilgrim and really the church community across the greater West Side, the Black church, trying to use some skills in organizing churches and organizing people and advocates. So we have other pastors in our leader network, like Reverend Ira Ackrey out in Austin at the Greater St. John Church, Reverend Cy Fields at the New Landmark Church in East Garfield Park, and then over 30 plus organizations that are part of our leaders network, whose call begins shortly after this one. But community-based organizing, so that people have some self-determinative way of envisioning a community that includes us and does not simply remove us or gentrify us off the land, but having making sure that whatever the new West Side looks like, that it includes the people who live there already, has been the work that I've tried to do.
And then David, you started to talk about the action steps that the providers have vowed or made a commitment to take in the wake of the civil unrest and, calling out racism as a public health issue. Can you talk a little bit about what those actions are, and then maybe tie them into some of the work that's happening at Rush?
I mean, we were just on a phone call today. This was part of the mayor's racial equity rapid response team. And I said we should take out the rapid and just say we're going to continue on as a racial equity response group and hold the institutions accountable. So, we can all look at the historical origins of oppression and injustice and sit back and wonder, well, that was then and this is now. But one of the pieces that we have to address is accountability and responsibility. And for the sake of organizations, and just for the sake that for white organizations, that have been built up, there is an accountability and there's a responsibility. And if we just go about business in the same way that we did it yesterday, even good, well-meaning, we're not going to change the outcomes. We're not going to change the health outcomes. We're not going to change the community outcomes. It requires a giant shift for all the organizations, for all the institutions here. And so it starts with one, naming racism as a root cause of poor health and actually as a crisis. That was a big deal. And I think the moment carried it. I would say that 6 weeks ago to get all these institutions to sign on to racism and public health crisis or Black Lives Matter, it wouldn't have happened. It'd have to go to the board, it'd have to do all this stuff. But I do think the moment carried it to what both Reverend Hatches have said, and this is a moment we're called on and you've got to act. The next step is we have to understand that there's racism tied to, I call it toxic capitalism. You know, the economic system does not work for lots of people. And we have to name, like Martin Luther King named, materialism. It's a system that benefits, concentrates advantage for a few, at the disadvantage of many. And those who are disadvantaged and, you know, are Black people, but lots of people are disadvantaged by the system. And so the work of Westside United, the work of the institutions, the healthcare institutions, have to go beyond healthcare. It has to be economic opportunity. It's being led by the community in what the community wants from the, say in this case, the health systems in their own neighborhoods. Nothing about us without us. We need to follow the lead of the community. And what are the various ways that we can, guided by the community, again, invest in these neighborhoods? That was the idea behind Westside United, that there were these giant life expectancy gaps that were unnatural, unjust around it. I was telling my wife last night, I have all these new friends now that I didn't have before. And, you know, without friends, without these partnerships, you can't make the change that's necessary. But it's about economic change. It's about pathways into careers, and particularly in healthcare, where the next group of leaders are going to look like the community and not like me. So there's a lot about how do we together partner with the community, and that's the idea behind Westside United, reduce these life expectancy gap by addressing the structural underpinnings of the inequalities and the inequities.